Right, hello. We're here to talk a little bit about our allied health professions and culture. My name is Harvia. I'm a dietitian and I am a British Asian Indian. Does everybody want to introduce themselves as well? Afra?
My name is Afra El-Yufrasi. I'm an art psychotherapist. I'm dual heritage, Arabic and English.
Hi, my name's Farida and I'm a physiotherapist and I'm also dual heritage. So my father is a Muslim Indian and my mother is Swedish.
Hi, my name's Deborah. I'm an occupational therapist and I'm also dual heritage. So I'm Black Caribbean and I'm white British.
Thank you. So we're talking a little bit about culture and why is it important to talk about this part of AHP Day. So we know that, all the recent documents within sort of the NHS in terms of the people plan as well, it talks about a culture of inclusion. And how can we practice that if we don't understand each other's cultures? So we hope to touch on some of those points. Is to help initiate discussions around culture, and ultimately it's to provide better patient care so we understand our patients better and we can adapt the care we give to them. So thinking about culture in our professions, how does culture play a part within our individual professions? So if we start with physiotherapy and Farida, please.
Yes, so the Chartered Society of Physiotherapy does actually have a paper which gives some information on culture and cultural diversity, and it says that a culturally competent physio, you should recognise, respect and respond to individual needs and adapt your practice accordingly. Mm-hmm. So it does recognise the different cultures, but it can be difficult sometimes as a physio when you go into people's homes because they have different expectations of what physio is. Mm-hmm. Some of them have no understanding of what physiotherapy is apart from on the football field. So they don't really understand how it might help them. So you have to break down those barriers. There can be language barriers also. And another thing with physio, you're not sitting in a room opposite someone. It can get quite up close and personal. So you have to be very aware of different cultures and what might be appropriate or might not be appropriate.
Yeah, thank you for that. So yeah, I guess you've got to be aware of different people's cultural sort of barriers, and when we're treating patients, that's really helpful. Thank you. And Afra, regarding sort of art therapy.
So art psychotherapy is a form of psychodynamic psychotherapy and uses art to enable people of all ages really to communicate and express themselves when words become too difficult. Art has been part of our culture for millions of years and has influenced culture throughout time. So when working with clients, art psychotherapy does the same. It can be a bridge for communication and to allow people to connect and communicate in a way that feels safe and right for them. And we use art materials in sessions and people use that in any way they want to. So each person will use it in their own way and have their own process that they're working with. For me, art is really inclusive and supports people from lots of different backgrounds, disabilities, diagnosis, and it offers freedom to explore things like gender, sexuality, race, and for that reason, I think it's a wonderful medium to work with.
Absolutely, and that's beautiful that it's universal, isn't it, art? And the language of art is universal, so that's really great. Thank you very much. Deb, you want to talk a little bit about occupational therapy?
Yes, occupational therapy. So for us occupational therapists to practice in a client-centred manner, it's important to understand an individual's cultural needs by not setting any preconceived notions. So being able to engage with clients while having a blank mindset allows for feelings of confidence and the ability to be prepared for cultural differences and unknown situations. So being able to recognise cultural differences, active skills, cultural relevant assessments and observations that are focused on culturally relevant tasks and roles prompts that opportunity to enhance those skills, strategies and abilities of OT practitioners as well in the capture of culturally relevant patient information. What this then does is this then places less reliance on assessment and models largely developed and designed from westernised philosophies and practices to provide skills to patients that promote autonomy and independence, and making them less culturally and contextually relevant when working with patients with culturally diverse needs.
Great, thank you. So yes, it gives them that confidence if we understand their culture, because it empowers them, doesn't it? And I guess with dietetics, I think it's really important in terms of, food's a part of everybody's lives, and it's important to understand culture in terms of food, in terms of types of food, in terms of times of days of people when they're eating, and also things like fasting again as well. So it's important to understand how that happens and when that happens, and how it may affect someone's sort of health, and the advice that we can give. In terms of health inequalities as well, I guess we know that some cultures are more prone to things like heart disease, so it's ensuring that our advice reflects that, and we really understand that, and they understand that. And then I guess resources, so we've got a few resources, so in terms of, we've got an Eat Well plate, a South Asian Eat Well plate, which is kind of reflects some of the foods of different cultures. And I think with all the professions, there's probably still a lot of work to do with the types of resources that we have out there to make sure that all of our information is accessible. But it's good to hear that culture is a part of everybody's assessment as well, when we're thinking about our patients. So just thinking about culture in our workplace. So thinking about the project I've been working on, it's clear that there is a lack of diversity within AHP professions, especially within our ICS. So this means that actually maybe the conversations around culture don't happen that often, and racism is still part and parcel of working within the NHS, and maybe other organisations too. But for that to stop, really, I guess we need to be able to understand each other's cultures and ask questions in a respectful manner. And that's not just the responsibility of people from a B&E background or from a different culture, it's from everybody's responsibility. So I guess, what can we do? What can we do as individuals working in the AHP profession? We can acknowledge different cultures, we can learn from each other, we can celebrate each other's celebrations. It's a great way to talk about different cultures. And if you do see any racism, or if you do see somebody who is ignorant and not maybe asking those questions in a respectful manner, then speak up, because that individual may not be able to. But we're working together, I guess, as a team, and let's learn from each other. So hopefully that's a bit of an insight to start these discussions within your own professions, and learn more and go out and try and find more information as well about culture. So thank you everybody for taking part in this.